I am Dr. N.K. Venkataramana, Founder Chairman and Director of Neurosciences, Brains Super Specialty Hospital, Bangalore. The current research and incidence shows that the superbugs are tremendously increasing in the country, contributing to the infections. Infections are a tremendous threat for our patients, particularly in the surgical fields and in the critical care. Any infection following the surgery can not only damage the effort of surgery and also significantly affect the outcomes in terms of quality as well as longevity, disability, and sometimes if the infection is very severe, particularly in the critical care, it can even lead to death. Now, it has been estimated that the drug resistance is single most factor for the superbug resistance as well as the alarmingly increasing infections because of the disproportionate use of antibiotics. Now, we need to use the drugs very sparingly, appropriately, at the right time for the right cause so that we can preserve the integrity of these medicines, avoid the infections is the best way to reduce this drug resistance and the superbug calamity. Now, this is particularly very important in all surgical fields, more so in the neurosurgery, as it is the very delicate surgery. Apart from that, any infection to brain after the surgery can result into serious neurological sequelae. In addition, the surgical outcomes can change. Now, all over the world, people are considering various methods and fighting against this resistance for over a time. But despite all this, nearly 38 to 40% of the infections are becoming drug resistant. The best way to avoid drug resistance is to see that the infection doesn't occur. So one of the ways is to implement very rigid, strict processes in the hospital and use the appropriate materials. Brains Hospitals is very proud to announce that we have overcome this problem to a great extent. We have been using CitroBioShield, a very novel and innovative method. CitroBioShield is a very organic product derived from the citra alkaloids. And these alkaloids have been found to have tremendous amount of antibacterial, antiviral, antifungal, anti-parasitic effect, even affecting not only the bacterial, viral, as well as the cysts, and that can persist and cause variety of parasitic infections later on. Using advantage of this efficacy of this citra alkaloids, we have been using fumigation methods as a prophylaxis both in the operating rooms as well as in the critical care. We have almost circumvented the problem that our post-operative infections are literally zero. And except the people who come from the outside hospitals with the already existing infections, our inherent hospital-based infections in the critical care is being very, very low, much below the expected standards. So this is a great achievement we feel, and we would like to share this happy news, especially the week between 18th and 24th is being celebrated as Antimicrobial Resistance Avoidance Week. And this awareness is very important. And this not only use of one single material, a strict protocol and etiquette of all the hospital staff, particularly supporting staff and the medical staff, needs to be implemented very strictly, and very robust protocol and a continuous monitoring can achieve this success. We are very happy to say that this is a possible thing, but same time there is an imminent threat that this can increase over the time, and one should be aware of and be vigilant all the time to see that this problem can be avoided so that our patients can be safe, hospital staff also can be safe, and community infections can be reduced.
Hello, I'm Dr. Adesh. I'm a senior consultant neurosurgeon at Brains Hospital, Bangalore. At Brains Hospital, we are celebrating the Antimicrobial Resistance Week from 18th November till 24th of November this year. So the WHO theme for this year is Act Now, Protect Our Present, Secure Our Future. So we know that this underscores an urgent truth that antimicrobial resistance is no longer a looming future threat. It is affecting our lives at present and the healthcare system too. So in our Brains Hospital, we are strictly observing this, giving this week a due diligence by conducting CMEs, CNEs, public awareness programs, as well as educating the paramedical staffs, as well as making sure that there is adherence to the protocols. So in this realm of clinical neuroscience, the message resonates deeply that as neurologists, neurosurgeons, and neurointensivists and neuroscientists, we rely on antimicrobial therapy for CNS infections, neurosurgical prophylaxis, also in immunocompromised patients and more. The rise of resistant organisms threatens the core of safety in this neurocare. So why antimicrobial resistance matters? So first of all, neuroinfections and CNS infections like meningitis, encephalitis, brain abscess, they require prompt antimicrobial therapy, otherwise they can be life-threatening as well. Also, because of the presence of blood-brain barrier, the crossing of antimicrobials into the brain is limited. So patients may require higher doses and for a longer period of time. So this again increases the risks and chances of development of antimicrobial resistance. So it is very imperative that whenever a prophylactic antibiotic is started, it is reviewed again after 3 days or till the culture report comes and appropriate antibiotics are chosen. We should not start with high-end or reserved antibiotics. So it is very important to maintain antimicrobial stewardship where the responsibility and the ownership lies within the prescribing doctor, as well as a monitoring of the doctor's prescription so that misuse can be avoided. Next, there is collateral neurosurgical implications, that is beyond the infection treatment. There is always something called as a microbiome gut-brain axis. Research have shown that antimicrobial use can influence the neuroimmune and endocrine functions, which has implications on neuroinflammation, neurodegeneration and neuropsychiatric conditions. So while not solely about antimicrobial resistance, this underlies how antimicrobial stewardship and microbiome preservation is very important in neurological outcome. We should also think about the complexity, the cost that the patient and the hospital incurs, and also discuss about future therapies that are related. So antimicrobial resistance increases the cost because we have to prescribe a higher antibiotic. It also increases the length of ICU stay. It also worsens the outcome of the patient. So with these, I think I would like to say that it is very much imperative that we act immediately. We have to make sure that our present is protected, and we have to make sure by following these guidelines, making these guidelines and strictly adhering to antimicrobial stewardship, we can secure our future. Thank you.
Hello, I am Dr. Pavitra, Chief Neuroanesthetist from Brain Super Speciality Hospital, Bangalore. This week we'll be celebrating the World Antimicrobial Awareness Week. Just by adhering to WASH protocol, that is water, sanitation and hygiene protocol in the ICU, we will not be able to prevent infections in the ICU, that is hospital acquired infections. So our Indian Council of Medical Research has proven that in 120 ICUs across 39 centers in India, it is revealed that there is 38% of superbug infected ICU patients who die within 2 weeks of their ICU admission. So air and surface infection should be prevented and controlled in ICU on a daily basis. With the presently available toxic disinfectants, we are unable to prevent infections occurring in the ICU, especially ICUs which have to be frequently fogged. we are unable to do that because of the existing patients in the ICU. So the need of the hour is to find some kind of fumigation method or fogging method with the patients in the ICU. So in Brains Hospital, we are using CitroBioShield fogging method. So without relocating patients, and we have achieved zero hospital acquired infection rate, and also there is very less prevalence of antimicrobial resistance in our ICU. So this is a new standard we have created in our patient safety. So we request global AMR media alliance, that is a GAMA, to bring awareness on this method of preventing HIA and AMR in the ICU setup. So interested hospitals can contact Brains Hospital for further information. Thank you.